Welcome to the deep dive. We're here to sift through that pile of sources you sent us, really get into the details, and figure out what's actually going on.
That's right.
Today, it's quite a big one, a major event, a real shakeup involving a key CDC advisory committee on vaccines.
Yeah, lots of buzz around this one.
Absolutely. So you've sent us articles, reports, backgrounders. Our job is to unpack it all, what happened, why it's causing such a fuss, and look at the different takes in your sources.
Okay, so the body we're talking about here is the Advisory Committee on Immunization Practices. You'll see it called ACIP.
ACIP, right.
And your sources describe it as, well, basically an independent panel. Experts, scientists, public health folks. Their whole job is advising the CDC on how vaccines should be used here in the U.S.
Okay, so they make the recommendations.
Exactly. And for a long time, like decades, they've been seen as the trusted source. Objective, data-driven advice.
And their recommendations matter because
Oh, hugely. They're the basis for the CDC's official immunization schedules. Kids shots, adult vaccines, they guide state programs, and, this is key, they heavily influence what your health insurance will cover.
the insurance link, got it. And even liability protections.
I too, yeah. So a very important committee, not just some academic exercise.
Clearly. So historically trusted, very influential. What's the big event that all these sources are focused on?
The main event happened June 9th, 2025. According to all the material, that's the day HHS Secretary Robert F. Kennedy Jr. announced he was removing all the members, all 17 of them.
Wow, all 17. Not just a few, but the entire committee.
The entire committee.
Right.
Gone.
Yeah.
And your sources are really clear. They call this unprecedented.
Yeah.
Never happened before in ACP's history.
Unprecedented, that's certainly a strong word. And it begs the immediate question, why? Why do something so drastic to a committee described as, well, trusted and vital? What was the secretary's reasoning?
Well, according to the sources, he explained his rationale in a few places. An opinion piece in the Wall Street Journal, an official HHS press release.
Okay.
And the main stated goal, the headline reason, was to restore public trust. Trust in vaccine policy. Trust in the science behind it.
Okay. Restore trust by firing all the experts. That sounds a little backwards on the surface. How did he connect those dots, according to what you read?
He made a couple of key points. He argued, or asserted, that ACP had been, quote, plagued with persistent conflicts of interest.
Conflicts of interest, okay.
And that because of these conflicts, it had become, again, his words apparently, little more than a rubber stamp for any vaccine.
A rubber stamp. So the idea is they weren't independent enough.
That's the claim. He's quoted saying a clean sweep is needed to reestablish public confidence in vaccine science. He even mentioned some alleged examples of conflicts, but they were from quite a while ago, like the 90s, early 2000s.
Older examples, but he argued the problem persisted.
He suggested it did, yes, that these issues undermine the committee's integrity and therefore public trust.
So his narrative is, conflicts, rubber stamp eroded trust, need a clean sweep to restore trust. Is that about right, based on the sources?
That seems to be the core argument presented, yes.
Yeah.
He also mentioned something about appointments.
Oh, what was that?
He pointed out that some members were appointed late by the previous administration. And because terms are staggered, his administration wouldn't get to appoint a majority until, like, 2028.
Okay. So part of the justification was needing to get his own appointees in sooner.
He sort of implied that, yeah. That the clean sweep was necessary to reshape the committee faster. Administrative timing, you could call it.
Okay, so conflicts, restoring trust, and getting new people in place. That's the case he made. But, as you hinted, the reaction reported in these sources. It wasn't exactly supportive, was it?
Not at all. That's where this gets really interesting. While the secretary's talking restoration, the medical and public health communities, massive pushback, almost universally negative, based on these materials.
Arguing the opposite would happen, you mean? That this damages trust. And
precisely. That's the dominant theme in the criticisms reported across the board. Medical groups, former officials, public health experts, they're saying this move is far more likely to erode confidence, not rebuild it.
Such a direct contradiction. What were some of the specific concerns they raised?
A whole range. Major groups like the American Medical Association, the AMA, put out statements pretty quickly.
What did the AMA say?
They said this action actually undermines that trust.
Right.
They called ACP a trusted national source and said this upends a transparent process that has saved countless lives. Strong words.
Very strong. What other concerns came up? Politicization.
That was a huge one. Experts quoted worried this injects politics, maybe ideology, into what should be a purely scientific process.
Right.
Dr. Tom Frieden, former CDC director, called it dangerous and unprecedented. He said it makes our families less safe, and flat out stated politicizing ACP will undermine public trust under the guise of improving it.
Undermine it under the guise of improving it. That's quite a charge.
It is. And Dr. Celine Gounder echoed that, suggesting ideology creeping in will compromise trust in public health.
So the fear is that future recommendations might not be based solely on the evidence.
Exactly. That political leanings could influence guidance. The American Academy of Pediatrics even framed it as part of an escalating effort to stoke distrust in life-saving vaccines.
Wow. Linking it to a broader anti-vaccine sentiment effort?
That's how they characterized it, yeah. And Dr. Jason Goldman from the American College of Physicians warned it will seriously erode public confidence and could even, potentially, endanger patient safety.
Endanger patient safety? How did they make that connection? What's the mechanism there?
Well, the argument reported is that trust is essential for vaccine uptake. If people don't trust the source of the recommendations, ACIP via the CDC, they might skip vaccines.
Ah, okay. Lower vaccination rates.
Right, which could lead to more outbreaks of diseases we can prevent. Experts were quoted saying this kind of mass dismissal is far more likely to destroy public confidence than to restore trust.
They saw it as overtly political then.
Overwhelmingly. Described as a blatantly political act that harms scientific integrity rather than helping it.
And you mentioned international standing.
Yes, Paul Offit, he's actually been on ACP before. He emphasized how vital the committee is and worried this could make U.S. vaccine policy, his words, the laughingstock of the globe.
Laughingstock. Ouch. That really suggests a loss of credibility.
It definitely captures the severity of the concern from some experts. And then there was Senator Bill Cassidy. He worried the committee might get filled with people who were just suspicious of vaccines, not actual experts.
Right, replacing expertise with skepticism. Yeah. Okay, let's go back to the conflict of interest claim. That was the Secretary's main justification. What do the sources say about how ACP actually handles conflicts, especially lately?
This is a key point of contention in the sources. They push back hard on the Secretary's narrative here.
How so?
Multiple sources explain that ACIP members are already under strict federal rules about conflicts. They have to disclose potential conflicts, financial ties, industry connections, whatever.
Standard procedure for these kinds of panels, usually.
Right. And crucially, if a member does have a conflict related to a specific vaccine being discussed, the rules say they have to recuse themselves, sit out the discussion and the vote.
So there are safeguards built in, disclosure and recusal.
Exactly. And the sources stress that this system is in place and followed. They state pretty clearly, no documented breaches of these rules in recent years.
No breaches. So the system, according to these sources, is working as intended.
That's the picture they paint. While the Secretary mentioned those older examples from the 90s or 2000s, the reporting on the current situation says the rules are robust and being followed now.
Okay. But what about that government report Kennedy supposedly cited?
Ah, yes. One source makes a really specific point about that. It says a government report Kennedy has apparently used to back up his conflict claims actually found the opposite.
Wait, the report he cited concluded there weren't disqualifying conflicts.
According to that source, yes. It found members were following the rules. So that directly challenges the factual basis of his main justification based on that reporting.
That's significant. A direct contradiction reported in the source material.
It is. And sources also bring up the practical challenge, finding top-tier experts in a super specialized field like vaccines who have zero connection ever to industry. It's tough.
Almost impossible, probably, for the leading people.
Right. So the focus usually isn't on finding unicorns with no ties, but on having a transparent system disclosure, recusal to manage potential influence. That's standard practice, the sources note.
Okay, so the conflict of interest argument looks pretty contested in the sources. Now, what about those other allegations? Something about promises made during his confirmation.
Yes, that's another major thread of criticism running through the sources. It involves commitments reportedly made to Senator Bill Cassidy.
Cassidy again. His vote was important for Kennedy's confirmation, right?
Apparently key. And sources say Cassidy claims that Kennedy, in private talks to secure that vote, specifically pledged to.
To what?
To, quote, maintain the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices without changes.
Maintain without changes. That phrase is directly quoted.
In multiple sources discussing these alleged assurances, yes. It sounds pretty unambiguous.
It really does, and obviously firing the entire committee isn't exactly maintaining without changes.
Not quite, no. And so Senator Cassidy himself, along with other critics cited in the sources, view this mass dismissal as, well, a broken promise, a direct contradiction of what was allegedly pledged.
So it raises questions about trust on another level, trust in commitments made to Congress.
Exactly. Some commentary even suggests it looks like he might have misled senators to get confirmed. Sources also mention other promises about working within the system, which critics say this move also breaks.
Okay, so multiple layers to the controversy. Let's pivot to the impact. What do the sources say about the timing and the potential consequences, especially for people listening, for public health?
The timing seems really crucial, based on the reporting. This happened June 9th. ACIP had a meeting scheduled just about 2 weeks later, June 25th.
And that meeting was important because
They were expected to vote on new recommendations. Several important ones, actually. Sources mention COVID-19 vaccines, the annual flu shots, meningococcal vaccines, RSV vaccines.
things relevant right now, basically.
Very relevant, especially RSV for older adults and infants. That's been a big topic. And sources also noted something else interesting.
What's that?
Recommendations that ACIP already voted on back in April for RSV and meningococcal vaccines hadn't actually been adopted yet by the Secretary's office.
So maybe a slowdown was already happening before the dismissal.
It suggests that, potentially.
Yeah.
A disruption in the usual flow.
Okay, so the committee gets removed right before these votes. How does that ripple effect actually reach, say, you or me? How does ACIP's work translate into real-world access?
It's a critical chain. ACIP makes the recommendation. The CDC usually adopts it. That goes into the official immunization schedules.
The lists doctors and public health departments use.
Right. And then, crucially for most people, insurance coverage, Medicare, Medicaid, private plans, they generally follow those CDC-adopted recommendations. If it's on the schedule, it's much more likely covered. Makes it affordable, accessible.
Got it. So breaking that chain.
Creates immediate uncertainty, delays votes, slows down schedule updates, potentially holds up insurance decisions. People might have trouble getting needed vaccines or face paying out of pocket while things are sorted out.
And the critics connect this directly to health risks?
They do. They worry this uncertainty and delay makes us more vulnerable to outbreaks.
Yeah.
The AMA president was quoted pointing to existing measles outbreaks and falling childhood vaccination rates before this even happened.
Saying this will make things worse.
Yeah, warning it will further fuel the spread by adding confusion and possibly hurting access. Senator Bernie Sanders was also quoted criticizing actions that seem like doubling down on misinformation, saying it will lead to preventable illness and death. He called it part of a dangerous war on science.
Wow. That really frames it in terms of life and death consequences. It brings it home. Okay, let's try to pull this all together from the sources you reviewed. What does this whole situation mean for you, the listener? Why should you care about this specific committee shakeup?
Well, I think this deep dive shows understanding this process, how vaccine advice is made, who makes it, how it's challenged. It's really important for a couple of reasons.
Okay, first.
First, just for making your own informed health decisions, for you, for your family. Knowing where recommendations come from, the debates around them, helps you evaluate the health information you encounter.
Makes sense. And second.
Second, it really shines a light on our public health institutions.
Yeah.
How they work, or how people think they work, especially where science meets policy and politics.
Yeah.
This whole episode, as reported, is like a perfect case study. You see these clashing views on the best way to ensure public confidence and scientific integrity. Is it sticking with the established transparent process? Or is it making drastic changes to fix perceived problems?
It really does lay bare those tensions, how you build trust, how you maintain it, how easily it can be damaged, maybe.
Exactly.
Okay, thank you. That really helps synthesize everything from the sources. We've covered the Secretary's stated goal, restoring trust, and contrasted it with the strong pushback saying this undermines trust and politicizes science. We looked at the potential real-world impacts, too.
And it all highlights that fundamental tension, doesn't it, between political leadership, independent science, and that crucial element of public confidence.
It absolutely does. And it leaves us, and hopefully you listening, with a pretty big question to chew on, a question that really comes out of all these different perspectives and the sources.
Which is?
How do we, as a society, best balance political authority with independent scientific advice, especially when public trust in health institutions feels so fragile?
It's not an easy question, and the events described here certainly force you to think about it.
Indeed. And that's why we do these deep dives. Keep digging, keep asking questions. That's all the time we have for this deep dive. Thanks for joining us.